Hi everyone, I'm Alicia, and today I'm joined by Dr. Bilski from Bilski Dental Group. How you doing today?
Great. Good morning.
Good morning. So in this video, we're going to be talking about root canal laser therapy.
Yeah.
So first of all, what is that?
Old school root canal scares people to death.
Yeah, you just hear it. And
It's just crazy.
You don't want it. Yeah.
When a root canal is provided, what we're essentially doing, and I like to use analogies, I hope this is a good analogy. Picture a hard-boiled egg.
Okay.
A hole is made into the eggshell, the egg white, and we're removing the egg yolk.
Okay.
All right?
Yeah.
So inside a tooth, it's called the pulp, would be the egg yolk. It's not hard like a hard-boiled egg.
Yeah.
It's kind of slushy, and or if it's infected, sometimes just a dead airspace.
Okay.
That's where the swelling comes from. What we know in laser dentistry and root canals is that you have to eliminate the endotoxins, the bacterial poop that is developed from the nerve dying
Okay.
or an infection that entered into the tooth. However it got there, that's not for this discussion.
For another video.
Exactly. So our technique is make an opening into the tooth after you're numb, clean out the inside of the tooth, reshaping it, and there's instrumentation, and picture a tornado or a sugar cone,
Okay.
ice cream cone. That's the shape we want to get in our brain. Then we use a peroxide cream, make sure that that's cleaned out, rinse it. I call it pool water. It's a chlorine bleach and water solution.
Okay.
Sometimes on severe infections, we use full strength bleach. You're all protected. It's nothing to worry about. It's very safe. Then we allow that to sit for a few minutes. Could be 15 minutes, could be 30 minutes, it could be 45 minutes, depending on the severity.
Right.
And then we would fill the tooth with a calcium biotic, which is like a sealer. And another analogy is if I had a wine bottle and a cork with warm wax, I would dip the cork in the wax to seal the bottle. The cork is not sealing the bottle, the wax is.
Right. Okay. Makes sense.
The gutta percha, the root canal filler, is dipped into the calcium sealing cement and placed into the tooth. That works reasonably well. There's a lot of literature on success rates.
Okay.
What we're finding out is that there is a leakage that occurs over time.
Yeah.
So why that is, there's a lot of, again, more video discussion.
Yeah.
But in the sense of laser therapy, so we do all that stuff, clean out the tooth, we disinfect with the bleach and the peroxide, then we dry it up, and then we take our CO2 laser and we place it inside the tooth. CO2 lasers are searching for water. Anything that's left inside that tooth, residual water, residual bleach, any peroxide cream, gone.
Okay.
All right?
So it gets it all out of there.
And also removes viral and bacterial contaminants.
Wow. So it prevents infection as well.
Right.
Wow.
So we sterilize as much as we can, or disinfect is the actual term, decontaminate, seal it with the calcium biotic after we use the CO2 laser.
Okay.
And we've had great results. Combined with that, we have new robotic technology that we actually, I don't even need to take an x-ray. We do take x-rays, but it searches and locates the total length of the root canal.
Wow.
So back in the old days, you would see a lot of too long root canals or too short. Too long, too short's not good. We need the Goldilocks.
Yeah. Right.
Not
You
too
need
hot,
to know
not too
exactly
cold. It's
what's
got to be
going
right
on.
there.
Yeah.
So I'm a key opinion leader for this robotics, so I get to try stuff out.
Wow.
And we actually did a start to finish molar root canal. It's your back chewers, which are the more difficult root canals to do. And did not take an x-ray until we completed the therapy. And it would have looked like we took all the x-rays and pre-measured and done. It's that significant, that sophisticated.
So we're really dealing with the future of dentistry.
We're dealing with robotics and digitizing things that we used to have to use our hands and our eyes.
Yeah.
Now we can utilize the technology, the science, virtually do things, looking at a monitor. then that'll even go into GPS location dental implants. There are robots out there right now that we're going to bring into our practice where that robot arm, I hold the drill and it can only go where it's GPS located. Which when you're working with some significant structures in the mouth, it takes away a lot. Now you still have to be a human being and check to make sure it's in the right spot.
And that's where you'll always be there. But these progressions that are happening, it's so important to stay on top of those.
So back to root canal, scary.
Yeah.
It shouldn't be, other than you have to do it sometimes. In our practice, we're very relaxed. We're so confident and comfortable with the technology. We've been using it for years.
As you should be.
And the combination of the two, utilizing robotics along with the CO2 laser, decontamination.
Yeah, you're finding all the easy ways for the patient.
Absolutely.
Faster and better for them.
We can reduce the amount of time that you're in the office. You used to take multiple appointments on a molar root canal. Now we're doing them in less than 20, 30 minutes.
So is there a lot of recovery time for that kind of procedure?
Because of the robotics and the technology, and we're able to lightly go where we need to be, it's less traumatic for the patient. So atraumatic procedures.
Wonderful. Yeah. Well, it sounds like that is definitely the way that the future is moving, and I really appreciate you telling me a little bit more about that.
I've been doing this 32 years.
Yeah.
I'm not going to do it for 32 more. And I wish I was younger because it's just going to get better.
Yeah, and you're going to wish that you could be there for all of those moments.
Yes.
But you know what? You're there now, and you're finding out about these things, and you're sharing that knowledge with your patients and other dentists.
And we have young dentists that work for us. Dr. Timmerman right now is going to be there a long time. He's only 36 years old. He'll
be able to take the reins.
I'll come in to bother him, have my cup of coffee, and say hello.
Yeah, of course. So if you'd like to find out more about Bilski Dental Group, you can contact them. You can call the number on the screen to schedule an appointment with Dr. Bilski, or you can visit them online at bilskidds.com.